Joining me now on Skype is Dr. Eustace Fernandes, a pulmonary and critical care specialist in Indiana. Dr. Fernandes, welcome back to the show. Good to see you.
Thanks for having me, Tracy.
Absolutely. Before I get started, though, I like to remind our viewers that you're speaking to us as an individual and not on behalf of one of the hospitals where you work. I'd like to start out by talking about the rise in the number of cases here in the United States. What do you make of that, and what do you think that says about our ability to control the spread of the virus?
I think that we expected a rise in the number of cases as the economy and the states began to open other venues. It wasn't altogether a shock to see the numbers go up. As I said before, we're prepared to deal with these patients, but we also now are beginning to see some of the collateral damage or the consequences of prolonged quarantine. So we have a bunch of other medical illnesses that have continued unchecked. So not only are we seeing a relative uptick in the number of COVID-19 cases but we're seeing other forms of illness, whether it's heart attacks, strokes, undiagnosed cancers, other areas of regular health concerns that haven't gone to sleep on us. So we're bracing ourselves and preparing ourselves to take care of all of those patients across all venues. What that means is finding creative ways to selectively isolate patients, to give them the care they need, and to really continue to screen rigorously for patients with coronavirus.
Yeah, and some have suggested that the rise in cases is linked to an increase in testing. What are your thoughts on that?
I think some of it has to do with increased testing. So our availability compared to the last time we spoke is head and shoulders above in terms of availability of testing. So we are testing more people. We're still getting about the same number of positive tests. So of the number, we're testing about 10% of those patients are actually positive for COVID-19. So that number is understandably going to go up. Our level of hospitalization has gone up slightly since our state has reopened. The severity of disease is about the same. So we haven't seen a huge surge in the number of hospitalized patients, but the severity of just one patient's illness is a little hard to put into words and is pretty sobering to behold.
Recently, there's been some talk about the virus becoming less deadly and losing some of its potency as time goes on. What do you know about that? And if that is indeed true, could it be possible that COVID-19 could maybe burn out, so to speak?
Well, many people have written about this, and in my world, it remains something that's theoretical. Would it be wonderful if that happened? Absolutely. All of us would like to see COVID-19 die a very quick death. Right now, our main job, I think, is to be vigilant. And it goes back to the basic things we've talked about before, which include good hand hygiene, wearing a mask, practicing reasonable social distancing, and avoiding, as a healthcare worker, avoiding prolonged exposures to patients who have COVID-19 or are under suspicion for having COVID-19. So it's really kind of common sense things that we're still emphasizing and remaining hypervigilant about.
What are you seeing there in your practice in Indiana? Can you talk a little bit more about that? And also, have your approaches maybe changed when it comes to treatment?
What we're seeing in Indiana is certain outbreaks throughout the community. And then we see hospitalizations rise, plateau, and our treatment availabilities, our ability to secure drugs and enroll patients in clinical trials have increased. There are numerous clinical trials out there looking at novel therapies for COVID-19, because right now we haven't found the silver bullet. There's been a lot of talk about a number of different drugs, whether it's hydroxychloroquine or remdesivir or Actemra or convalescent plasma. And all of these seem to maybe have a role in therapy, but none of them being the slam dunk that we're all hoping and praying for.
Well, Dr. Fernandes, thank you so much for your time. We really appreciate it, and we really appreciate all that you're doing to keep everyone safe. Thank you again.
Thank you.